You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. And if you are thinking you are headed to a denture, you got to hear what Dr. Smoler has to say. He's probably the busiest implant dentist in all of Michigan. With us, we have Dr. Bruce Smoler. Dr. Smoler, welcome to the program.
You. Glad to be here.
Now, you probably are one of the busiest. I know you don't want to brag about yourself, but is that right?
We help patients from all across the Midwest, even out of the country sometimes. We get patients from Canada, from Mexico. Westland, Michigan, it's 15 minutes from the airport. Who would have thought that a blue-collar office, not a fancy office, we're attracting patients from across the country. And it's a blessing.
So the typical patient that comes in, they still have their teeth, but the teeth are so bad, I guess they have to be removed.
Yep.
So who is your typical patient?
You know, there's no just one typical patient. We get the patient who's just tired of going in 4 times a year and getting their teeth scraped. And
what do you mean by that? What do you mean by that?
So they go in and they have something called scaling and root planing. They've got gum disease and they've had it for years, and it's progressively getting worse and worse and worse. Their teeth are getting loose and mobile.
Is this an infection that's going on
It's
in
a
the mouth?
gum disease infection, and for some reason, they just aren't being told of the options available today. So they're talking about a procedure called gum surgery, to go in there, scrape the gums, peel back the tissue, add bone around these teeth. So what happens is they're doing all these techniques to try to save these few teeth in their mouth.
Okay.
It reminds me of that story, the lone survivor. I actually had a patient who had 1 tooth left on her lower jaw. And she was taught that you should try to save your teeth for as long as you can. And she just couldn't get past the fact that she had 1 tooth left. And it was absolutely amazing helping people live better, to change their lives with dental implants.
Okay, now in your practice, and we've talked a little bit about this, we've also had you on the show to talk about what you do for denture wearers, but if a patient, and correct me if I'm wrong, could come in, they have really bad teeth and gums.
Yeah.
You could, I guess, safely remove the teeth, clean up their gums, give them a brand new upper and lower set of teeth supported by dental implants, and do that in 1 day.
Absolutely.
Is that rare?
Oh no, you know, we do that every day. It's amazing, the technology. I mean, years ago, it used to take months, and you'd have to take teeth out and wait. You'd have to put in implants and wait. And it was such a long process. Sometimes it would involve sinus grafting. I mean, we haven't done that technique in such a long time.
Is that old school to do all of this bone grafting and sinus grafting?
Well, we don't do it anymore.
Okay, that's a polite way of saying it, right?
Yes, yes.
But if you have bad gums, like this gum infection, aren't the gums too bad to be able to hold the implants in?
No, and let me tell you why. So teeth are held in place by bone that's at the top edge of the gum or the jawbone. So that's called residual bone or ridge bone. Well, we actually use bone to support implants down near the cortical levels of bone. So the area where implants go is different than where infected gums are around teeth. 2 different types of bone, 2 different areas in the jawbone, and it's sort of like old school to think that you can't get implants if you got gum disease.
And this bacterial infection goes away?
Yeah, because you're removing the source. So what ends up happening is, you know, you throw the teeth out with the infection, then you have good, healthy bone for dental implants.
Let's talk about your center for a moment, and correct me if I'm wrong. So the way dental implants are typically done is you go to one doctor that does the surgery, another doctor that puts the teeth on top, and then another office that maintains them. You do all 3 parts, and I guess you have digital printers that print and mill the teeth right there in your office.
Yeah. Isn't it
Is that
crazy?
why you do it so quickly?
Yeah, and it's not just because we're able to have all the technology. We have the training and the ability to do more than most other offices. So we combine the services. We have a new system that allows us to do things better than ever before, because the type of treatment we had even 2 years ago, now they just came out with new types of technology that's even faster, better, quicker than ever
Is
before.
it the imaging? Now, you also have a robot.
Yeah.
What's the robot role?
So the robot,
And why is that so good?
So the robot allows us to do things more precisely, more accurate, minimally invasive. I mean, it's unbelievable what we're able to do, because if you think about it, something minimally invasive, it's widely done in medical fields, but not so much in dentistry. So we've been a pioneer in dentistry, a pioneer in implant treatment to make it a better result as far as patients tell us. No pain, minimal swelling, and it's all because of the technology that we're able to use today.
So you brought some photos. What are we looking at?
So let me tell you about this lady. She was struggling. She told us at other offices, dentists made her feel bad.
How so?
That her mouth was so terrible. Well,
Like, why aren't you brushing? Or...
So why aren't you brushing, and how could you let this happen? And they judged her.
But isn't that a big part of this? I mean, she didn't brush and she didn't floss
You
and
know,
things like that?
that's what a lot of people may think, but it's not her fault. The teeth shifted. She's got work done that just trapped food and bacteria. I mean, she was brushing her teeth 5 times a day, using mouth rinse 5 times a day. What more could she do?
Okay.
It wasn't her fault.
So that's how you look at it.
Yeah,
That's
absolutely. And you know, she's there for a reason. She's there in our office for our help. And we're there to help her change her life. So she came to us because her only option was a denture.
So those teeth had to be removed.
Yeah.
Okay.
Yeah. And so
Young.
very young. And you know, she even looks younger. Look at that.
Wow.
And she goes around telling everybody she changed her life, that now she feels 20 years younger, she's able to eat and chew, and her only option would have been a denture.
So what'd you do for her?
So all the teeth came out. She was able to be sedated, so the IV, she was comfortable for the whole procedure. It only took a couple of hours. We print teeth in office, we design teeth in office. She wakes up to a whole new set of teeth.
So upper and lower teeth like that. I mean, she does look much different.
Yeah.
Almost looks like a bunch of porcelain veneers.
Yeah.
Like cosmetic dentistry.
It's unbelievable.
And she would have been in a denture.
Yeah.
Okay.
And at a young age to be in a denture, no wonder she didn't do anything for years. She was searching for an office that could listen to her and help her.
Now, when she looks in the mirror for the first time, what's that like?
Oh my gosh.
For patients.
The tears of joy, the happiness, it changes the dynamics of a family. So you have a mom who's now engaging, you have a wife who's now more attentive, you have someone who's more social with her friends. She sends us all these Snapchat videos and YouTubes of her. I mean, she's an influencer now.
Very nice. You say people with bad teeth, they tell you on the consult they feel judged by others.
Absolutely.
Can you elaborate on that?
So people will feel unclean. They are looked down upon. I
Like
mean,
they're poor?
Yeah,
Or...
and it's just sad that these people are being judged because they don't smile. Well, they're not smiling because who wants to show off bad teeth? So
Okay.
they look mean, they look sad, they look upset. What's her problem? Her problem is her teeth. They haven't found us yet.
So a patient like this, like what is her process?
Yep.
They come in,
So
what's
3
that like?
simple steps. The first step is they come in for a consultation. The second step is we design their smile. And the third step is actually the surgery.
They get their new teeth.
Yeah, and guess what? Sometimes it's all in the same day.
Really?
Unbelievable. We have the technology to do that. We do it all in office. We have a design set. We have the in-office lab. We have the 3D printers.
That's not how it's normally done. Is that correct?
Oh,
'cause you've invested
absolutely.
heavily in your own lab.
And we're still investing because new technology comes out.
Time for a few more photos.
Oh, yeah. So this woman came in. She was so despondent. And we call these patients hopeless, lack of hope. She's been struggling for years to try to find an office that could help her. Some offices made her feel bad that her teeth were in such bad condition. She had gone through a rough patch as far as her health, and she couldn't really even brush her teeth because her gums were so swollen. So we were able to help her.
I mean, was she told she needs a denture?
Yeah, they told her that her only option was to either live her life in pain and keep her teeth or get dentures.
Okay.
But if you look, what do you see about her smile? It's a very gummy smile.
Yeah.
The last thing that she could have was a denture. It would almost look like clown's teeth that were all gums and like Daffy Duck or someone.
So what'd you do?
Well, we did dental implants. We were able to take the teeth out, adjust the bone. We were able to have teeth that were attached to her implants. And
is that the same person? That's the same person, right?
It's really the same person. I mean, you think about when she started coming in, her life was changed. She
must feel great about herself.
Oh my God. She jumps into the office. She says, I'm here. She is so happy. It's a new person. So let me show you this guy. Kind of grumpy. He lived his life with a lower denture and upper teeth that were cracked and breaking down. And he was told he'd have to go to one office to get the teeth out, another office to get implants in, then back to the first office to get a denture. And he said, oh my gosh, that's awful. Or he could just come to one place. So the question is, how many offices do you have to go to in order to get your Smoler smile?
So with him, so what I'm looking at this after, those are upper and lower teeth that don't come out.
Yeah. And we were able to do it 3 simple steps.
Well, he looks like a different guy.
Oh my gosh. I mean, look at his smile. It's filled in. The wrinkles are gone. He's a happier guy. He actually comes in bringing donuts now. And he's just so happy. It's like a changed person.
It seems painful.
You know, that's what I hear. I don't feel a thing. But truly, the patients are numbed up.
Okay.
The IV in their arm, they go to sleep, they wake up to a whole new you.
And look, you're busy. Let's pretend that you had an opening in your schedule in tomorrow.
Yeah.
By the end of the week, they could have their new teeth.
Oh, they could have it in a day. So
somebody watching this today,
yeah.
If you had the opening,
yeah.
They come in tomorrow.
Absolutely.
You could remove their teeth, give them new upper and lower teeth supported by dental implants.
Isn't that incredible? I mean,
that's not an exaggeration.
I didn't even believe it myself until we see it.
Is this what you teach? Like when you're teaching other dentists?
Well, here's the problem. It's taken years of training,
okay.
Figuring things out. The technology alone can be price prohibitive for some offices who are just trying to get started. I mean, it takes a lot.
Okay, so if you're at the top of your game,
yeah,
a lot of experience, teach other dentists across the country, does it cost more to go to a guy like you?
You want to hear something crazy? We're less money than other people.
Just because what? You have your own in-house lab and make everything there?
We're more able to help more people.
Like efficient?
We're efficient.
Okay.
The way that we're able to do things today, we had a patient 2 weeks ago. He was quoted $15,000 to $25,000 more in Cleveland. And he couldn't believe it. He said, can I give you a deposit? Can I lock in that price? So he drove in about 3 hours and he says, oh my gosh, it's for real. What you told me is actually the truth. And he couldn't be more happy.
It's very nice. You know, people need to know, look, this is a real interview. I'm not trying to endorse you, but
right.
if anybody goes on that YouTube channel, you've got like hundreds of patient testimonials that are kind of bragging about doing this.
Well, someone has to do it. And then all the YouTube videos as well as our Google reviews. I mean,
Good.
Our goal, our mission is to help as many people as we can live better.
You really want to eliminate dentures?
Absolutely. That's our goal, to make dentures obsolete.
Is that the future of dentistry? Like whether it's 20 years or so, that dentures as we know them today they'll always be attached to implants.
Do
you think that?
I hope so. I honestly do. There's more people with dentures in this country than people living in Canada.
You have some more photos.
So take a look at her teeth.
All right.
They're worn down. They're flat. She's got missing teeth in back. People don't realize just because you have front teeth, it may look okay, but you can't chew. You can't bite. We need back teeth to grind up the food, front teeth to smile with. So flat, worn down teeth will look older. And she was just uncomfortable. She was miserable trying to chew and eat. People will have GI disorders. People will have problems digesting food because digestion starts in the mouth. She couldn't eat salads. She couldn't tear into food because her teeth were getting loose.
So what were her options?
Well, her options was to live each day miserable school, having teeth fall out on their own, and she's had teeth fall out, or get dentures, and her mama had dentures, and she didn't want dentures, and she was looking for an option.
So what'd you do?
We took out teeth, we gave her implants fixed on top of teeth.
Wow.
And oh my gosh, I mean, the smiles that she has, and that's just the beginning. When people sort of just get used to the idea of being able to smile again. We have a little ceremony, it's called a Japanese tea ceremony, where we say goodbye to who they were and say hello to the new person. Because it's not just teeth in their mouth, it's the psychology of saying goodbye to the person they were.
So they get more charisma? Like
everything.
Really?
They start dating. They start being a new person. They start living life. They start being able to do things that were limiting in the past.
Is it like other things in life? Like if you don't like something about yourself, it holds you back?
So all of a sudden, they change careers. They go back to school. There's actually a story about a woman, Julie, where at her 28th birthday, her family pooled their money. And I said, Julie, tell me about your story. She says, I work a dead-end job in a warehouse. I don't even date because who would want to date me? I've got teeth.
She says this to you?
Yeah. She says she has teeth like an ashtray. Who would even kiss me? Well, then the magic started. We took out the teeth. She was sedated. She was completely comfortable. We put in implants. She called us her dream team. And then she went back to school. After she quit her job, she met a guy, started dating, fell in love, had a family. She moved out of state. And she would come back every year and tell us about her life. So one of her kids grew up to be an EMT. And she said that the week before she came in, he actually pulled people out of a burning building. And she said, Dr. Bruce, without what you did for me, I wouldn't have had a family and my son wouldn't be saving lives.
Wow, that's a good story.
I mean, when I tell people what I do is change lives.
You even get a little choked up, it looks like, telling the story. But back to this woman. So when she looks at herself in the mirror for the first time, or all of the patients, it must be pretty dramatic to look at.
Oh my gosh, it's what we call a reveal. And it's so unbelievable. It's a humbling experience, what we get to do. There's Kleenex in every room. There's tears of joy. People just can't believe, and they feel bad that they didn't do it sooner. Okay.
All right.
Take a look at Victoria.
Okay.
Oh my gosh. She tells us the stories about what her life was like. She has buck teeth. She's had miserable experiences with dentistry. She was actually abused by a dentist because she wouldn't sit still in the dental chair. So she's a dental...
Like scolded?
Actually held down while he was trying to drill on a tooth.
Okay.
And she wasn't numb. I mean, the horror stories that scar people for their whole adult life.
Did they ever tell you they were made fun of?
Oh, she was teased during school. She had teeth that were out in front of her lower teeth.
Like buck teeth?
Terrible buck teeth and the gum disease because she couldn't bring her teeth together and have her lips close. So they would dry out. She would have gum disease, bad breath. She works as a nurse and she was so embarrassed by her smile. So she finally got up enough courage. It was 10 years since her last dental visit, and she thanked us for being kind.
So what'd you do for her?
So we gave her a new set of teeth on top of implants. Upper, lower teeth came out.
It's very nice.
I mean, absolutely incredible. She came back. She told us the story about her granddaughter. She says, Grandma, you're beautiful. Your smile is gorgeous. And she started crying, telling us the story. 2 weeks later, after she had the teeth for a few weeks, she said, Dr. Bruce, I'm breathing better. I can actually sleep through the night. And it's because her lips could come together. I mean, can you imagine what it's like?
Wow.
Where your teeth are so bad, her lips didn't even come together.
In your mind, can you see the end result? Like you see this woman, you hear her sad story.
Yeah.
in your mind, you must be getting a little excited. Like you're going, boy, this is going to be good. I mean, does that happen?
Every day. Patients.
Like, do you have to like kind of hold back your smile sometimes?
So I know more than what's happened to these patients for years as far as what we can do.
Okay.
And it's a process for them to gain trust with what we say, to back up the things that we're able to do. It's so different, it's life-altering, and they just have to realize what's possible. So we tell them to imagine, we do smile simulations, imagine what it's like.
Do you show them what their teeth are going to look like?
Yeah,
okay.
And we've been doing that for years. We do stem cell therapy, so there's little swelling. A colleague says, this stem cell stuff, how long have you been doing that? I said, yeah, it's kind of new. We've only been doing...
Like PRP or PRF?
Yeah, PRP, PRF. We've been doing that for 20 years. One of the first in Michigan to have that technology 20 years ago.
This just lowers the downtime?
So it lowers the downtime, reduces swelling, reduces inflammation, makes things more predictable. So let me tell you what's going on with Victoria today. She's a new person. She's able to smile. She's able to look at you in the eye. She comes in for her cleanings. She's telling us about how her world has changed and the places she's going, the things she's doing. And it's all because she chose to give us a call and change her life.
So when we're in the green room and I say, but it is just teeth. What is that? Does it make you want to strangle me? Like Randy doesn't get it.
Everyone wants to strangle you,
Okay.
But in this situation, it's more than just teeth.
Okay.
It's
I think that's obvious now.
It's changing her perception of who she is as a person. I mean, the person she knew for decades, her adult life, is gone. No more buck teeth, no more harassment, no more sleep apnea.
So she must feel good about herself.
Oh, she feels wonderful.
Time for a couple more photos. We're short on time, so I'm going to rush you.
So take a look at this young man.
Oh, wow.
And yeah, most people are a little bit older. He had some bad history with some problems with his health, and his teeth suffered.
That's got to be unusual.
Well, maybe like to that? You, because people don't smile. I mean, if you're walking around with bad teeth, you're not showing them off.
So you don't see it?
Oh, most family members
Did they ever say,
it.
Doctor, this is the worst you've ever seen?
Every one of them. And I try to say, nah, we've seen worse.
So this young guy would have had a denture?
Absolutely. And the thing, his grandma had dentures. It scared him to have teeth come out. So at one time, there's 3 steps. Come in for the consultation. We evaluate the mouth. We do a smile simulation. We design teeth. The second step is the surgery to be able to take out teeth, place implants. And the third step is to design and print teeth same day for the patient.
Right in your office?
Right in our office.
Boy, he looks good.
Absolutely.
Handsome guy.
Yeah. Absolutely. And the effect on his family is tremendous because he wants to engage people.
Do you believe that like the trajectory, I know you can't prove this, but the trajectory of this young guy's life, it'll be in a different direction because of his self-esteem and confidence?
People will talk about, people believe people who have a nice smile. So you're viewed differently, dishonest if you don't smile. His business, he's been promoted. He's looking to change his life as far as job and actually go into ownership himself. And there's no way he would have had the confidence to do that before. So this is a more typical patient where he's been suffering for about 40 or 50 years. His only other option was a denture. And he just couldn't understand why in the world he would ever want to have a denture. It changes how he speaks. He gives tours at a plant locally, and he said, I'm in front of people. I can't smile. I'm glad I have a mask on, but there's no way I would ever want a denture. So for him, he was able to come on in. We did a consultation. We showed him the possibilities. He says, oh my gosh, if that's what's possible, sign me up today.
Okay.
And we were able to get him financed. A lot of our patients will get financing. And we were able to start the same week that he came in. We got him into the schedule. The second step was the surgery, teeth out, implants in, and we made in our office teeth right then and there.
He legitimately looks a lot younger. I think anybody looking at this side by side.
Oh
almost
my
like
gosh.
the son of the before
and
photo.
Look at the sparkle in
That's a
his
good looking
eye.
smile too.
Yeah. We get lucky every once in a while. It all works out. So let me show you our next patient.
Okay.
So this guy was an engineer. He understood that too much force and too much pressure, something was cracking. One by one, his teeth were going bad. He was afraid to go to the dentist. He didn't want a denture. He had 2 or 3 consults at other offices. They all said the same thing. Oh, you don't have enough bone for implants. You're going to have dentures. He didn't want dentures. He was able to come in, he saw some reviews online, and we explained to him the different technology that nowadays we're able to do things better than ever before. So we're able to take out his teeth, place implants in, have fixed teeth on top of it, so no more dentures in his life.
Wow, look at this. So you take a picture of their after and they hold it right there. That's nice.
You know, it's absolutely incredible.
Are they surprised? Because I think you told me they forget how far they've come.
Yeah.
Because they never even looked at their mouth before.
Right. Well, they're embarrassed. They're afraid. There's some of our patients that they keep the lights off at night because they don't want, bad teeth are not sexy teeth.
And we should mention, look, Medicare, Medicaid, dental insurance doesn't cover it. But you say people finance this.
Yeah.
And it's not always just credit score, it's ability to pay.
Right. So we have lots of new programs. Patients sometimes will refinance their house. They're able to figure out a way to pay for it.
What about co-signers?
They'll have co-signers. Some guy had a boat he didn't use, so he sold his boat and got implants.
Very, very nice. I'm going to really rush you. We have 1 minute left, and I know you have a bunch of photos.
So this is one of the biggest fans. He shows up in our t-shirts, our swag. He tells everybody about the way he changed his life. He couldn't have been happier.
Is he wearing a shirt that says "Got Implants"?
Absolutely.
You have a store online where you could buy
a swag store.
Implant stuff.
Yeah, absolutely. So from onesies that say "Got teeth yet" to other t-shirts. Yeah, we really
So in
try.
as little as 3 appointments, they meet you. You design their smile and get their new teeth.
Yep.
But then you say it's even faster sometimes.
Yeah. So we can do it same day. It's absolutely
Maybe
amazing.
same day. Like somebody comes in, they already know they want to get it done. They still have teeth.
Yeah.
They come in, and on that day,
absolutely.
they can walk out that day with new upper and lower teeth that don't come out.
It's unbelievable.
Really?
We have that technology.
You have a robot. We didn't even talk about this robot.
I know.
But it's
I know.
The surgery, you're assisted with a robot for precision.
Yeah. It's minimally invasive. So the same thing in medicine as far as robotic surgery, it allows us to do things minimally invasive, less discomfort, more accuracy, fewer incisions, more precision. It's a game changer.
I want to thank you for coming on the show. Good stuff.
You're
really
welcome.
good. If somebody wants to make an appointment, they just go online, make an appointment, or just call you?
Either way, we're there 24/7. We've got ways to connect with people across the country.
Free consultation?
Absolutely.
So I guess, is that your message? Just come in and find out your options?
Yeah, just reach out. We're ready to help. Our goal, our mission is to help more people feel better about themselves.
Dr. Smoler, good stuff. Thank you.
You're welcome.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.